I grew up with my best friend being my grandfather.
We were born into this industry, and even our family sort of fell into it.
It started off with our grandparents, and both of them were involved.
I mean, this guy was just my absolute legend, and I saw him as dementia started to take hold in the late 90s. I saw him and I realized he's going to need more than my family can deliver.
The need in Pennsylvania for more long-term care facilities kind of, brought our family into this industry. But now that we're in it, I mean, it is just, it's become who we are.
So I've found this passion, towards senior care.
Our mission is, it comes back to family. And it is providing care and opportunities to those we serve in our communities and doing it based on and around our family values.
I think that anybody who steps foot in a nursing home to work is there for passion and mission. I mean, there is a portion of their heart that is wired to their brain that says that's what I want to do. And the passion and the drive that these people have to go in every day and to lift a patient or to hold a patient's hand who maybe is going through an Alzheimer's diagnosis where they don't remember holding that hand the day before. I mean, that is a patience and a drive and a passion that not everybody has.
They should be recognized. They should be recognized just by way of their achievements. They should be recognized from a compensation standpoint. We want to do great things for them because they've done great things for the residents. But, our hope would be that the state of Pennsylvania supports that and recognizes that and sees these folks truly as healthcare heroes. And I know that term gets thrown around a lot. And to the point that, we don't utilize it as much because it starts to feel a little cliche, but there's no greater words to describe the people that are doing this work out in the field.
It's the Lord's work that these folks are doing.
A couple of years ago, we had to forego a cost of living increase, which was the first time we had done that. And so now we have staff who leave and go to work for agencies. Agencies come in and charge us double the rate, and we can't compete with them without additional funding dollars to try to get caught up. There's a lot of talk about the need for any additional funding to go to staff. And I can assure you in our case, that's exactly where it needs to go. And that's our biggest challenge. And that's what we would put those additional resources toward.
Nursing homes all in have a profit margin nationally of minus 0.5%. Underwater nationally on a profit margin. Yet we still have to keep the lights on. We still have to deliver high quality care. We're getting an onslaught of new regulations, an onslaught of lawsuits, and all of the things that you would expect. But we're doing this at a negative profit margin nationwide. That's just not sustainable.
And nursing homes are part of the post-acute care continuum. After people are discharged from the hospital, this is an option for many people. And to carve out long-term care nursing homes from that care continuum would leave a big gap.
I really don't know what happens to many of the folks who are currently receiving care in our nursing homes. I'm not sure what options they'd have.
We are going to be spiraling toward this silver tsunami that's coming with the baby boomers that are aging. And if we don't have a fix in place when they arrive here, I fear for the families that need that care. I fear for the workforce that will be delivering that care. I feel for the administrators who will be managing that care. I fear for society.